You didn't build your product to be sitting on the shelf because of a scary buyer. But if you didn't address the hidden fear in the organization, then you already lost. Let's talk about how fear-driven culture inside of a long-term care organization and likely inside your own prospects company are quietly killing adoption, wasting resources, and blocking the impact that your solution meant to solve. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Rumbach, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. This is Sabrina Rumbach, your host, and today we are at Point Click Care with Varsha Chaugai. She is the co-founder of
Evoke Health.
Evoke Health. And we all know long-term care has been somewhat of the subdomain of healthcare that hasn't truly been looked like for a lot of reasons. When we discharge a patient, it's always, do you go acute care, long-term care, or people go home with family? Now, when we have to send people to long-term care, it almost feels like we don't know much about it and they're just out there. They have some kind of doctor, nurses, people on site, but is it really the false belief that people just got banked somewhere and they don't have the right support? And that's what we're talking about today is the transparency in having the right information for the patients, for the caregivers, and also the integration back to the physicians, whether they are the remote care that actually go to the long-term care to help, as well as all the subspecialty doctors when we do get consultation from people's, they came from facility, right? And how do we actually get the information, how they were doing in these facilities so we can see the trend and patterns. And as Varsha was saying, there's a lot of gaps in a digital health space in making all those integration. So what is that difficulty that you are speaking about?
So we at Evoke Health, we've built a resident and family communication platform that provides patients, their caregivers with information on their health. And it is very important in long-term care because the long-term care space has the strictest regulation compared to any other domains. I think the regulation here is compared to the nuclear space regulation, and it's a culture where there's a lot of communication that needs to take place. So when a family member, brings their loved one, the residents, as we call, into a long-term care home, the families have a lot of guilt. They've abandoned their parents into this long-term care home. They're really upset. And so one of the regulations in the long-term care is anytime anything changes with the resident, the nurses or the clinical team have to call the families and get their consent, have to notify them because they want to embrace this person-centered care and make sure the resident feels at home. Then there's a guilt from the kids, the children, the loved ones who put their family members in long-term care homes. So there's so much communication that goes on manually. So anytime there's a medication change or there's a new diagnosis or there's been a care plan change, the regulation mandate that you need to involve families, you need to call them, you need to take their consent. And it's all being done manually. They pick up the phone calls. And the people that they are reaching out to, family members, we are a sandwich generation. We have a teenage kids. We have an ailing parents that we are taking care of. We have a full-time job. And imagine getting phone calls all the time. Hey, I'm changing your mom's medication. Are you okay? It takes time for staff. It also makes the families feel guilty that, I have to answer this call. Maybe something went wrong. And also the families are calling all the time. Is mom okay? How is she doing? So there's so much communication that's going on. And we do it manually. Like, why are we using phone calls? We all are a texting generation. We all want things instantly, have 24/7 access, and also have the power of data in our hands to feel us, to make us feel empowered, to make us feel relieved that we don't have the guilt of sending our parents to a nursing home. And so when we started this company, because as an engineer, I was truly frustrated with how non-digital the healthcare is. We are still calling, we are still sending faxes. The systems don't talk to each other. And one of the gap that we saw in the long-term care, where staffing resources is always constrained, they always have to do a lot more with very less resources, very less funding. So technology can help, and things were really done manually. People are still getting on board with just using, integrated electronic healthcare system to charting. A lot of people still do paper charting. And so we thought, great, what can we do to alleviate the pressure on the nursing staff? And one of the things was communication. And we were like, why are they calling? There's patient portals with acute care. There's MyChart. There's other platform with acute care or with primary care. We can log into our lab app and see our lab results and hear the nurses have to make a phone call in a sector where these communications are mandatory. The communications are not mandatory in primary and acute care. So we were like, great, this is great. So me and my husband, we are engineers. We quit our job and we are like, we are going to build a patient portal and we're going to get into the door and we're going to do something really good. We're going to digitize the entire healthcare because, we are entrepreneurs. We want to do everything. And so we started with this patient portal. We built the technology in 5 months because it's a simple technology. It doesn't have to be very complicated. But trying to get people to buy it, trying to get them out of this culture where you're not going to be punished. This will help you collaborate with families on the care. This is going to improve the resident outcome because now families have an insight to what's going on with their mom, and they can give their input. And if something was amiss, because we are people, we all make mistakes, nurses make mistakes, families are going to collaborate because you're being transparent in care. They're not going to pick up the phone and call the state to complain that you didn't take care of their loved ones. So we thought we need to communicate differently in a way that it makes staff's life easier, gives them time to really do what matters most to them, which is not being on phone calls, but providing hands-on care. It also gives a peace of mind for the loved ones because oftentimes when a family member calls a nursing home to ask, how's mom? They're just calling to seek assurance, validation. And so what we found through our portal was that those questions were not happening because they're like, if something happens, they are going to notify me through this platform. And anytime they see something is changed, they talk to the nurses and they ask the right question, which is not how's mom. They ask questions like, oh, I see mom's weight have decreased. What can we do to improve it? So it's more of a resident quality care conversation than just seeking assurance. And what we've learned is it is such an underestimated and overlooked sector that people don't think having a family communication platform or communicating families electronically is going to save them time. And we have, through all our facilities that we are in, we have 75 to 90% of our families activate the platform. This is way more than the 40% activation rate that we see in primary care or acute care because families are really involved in the long-term care. Our nurses we've saved them at least 50% of phone calls that they were otherwise calling every day. Hey, your mom's med change. Are you okay? The phone calls still happen, but it's more for sensitive or emergency situation rather than how many grains of rice did mom eat or did mom sleep well? It's more centered towards quality care. And it's been an uphill battle for us because we are not trying to sell a platform, but we are really trying to bring that culture shift where we are trying to say you need to form a collaborative relationship with families by being transparent. And they're not going to be punitive. They're going to work together. You're going to have less complaints. You're going to have less investigations. And the overall experience for everyone involved in resident care, from staff to administrators to patients, their families, is going to be positive.
Right. So what I'm hearing is the platform for a patient and family is to, number one, is to reduce amount of time people have to wait on dial phone number. Those things can be sent through the portal because it's already existing. And it also helps family to guide the conversation of seeing what's actually not correct or what's the out of bound. Otherwise, most people don't have a clinical background. They don't even know what to ask. And that's why they are asking for reassurance in this general sense. They don't really know what's going on. So seems like it's a patient and caregiver platform that they can really quickly looking through the back end of the quality of the care and then what things has been changing for that patient.
Yeah.
And then for them to perhaps, if I'm hearing correctly, it's guiding them into the conversation on what they are seeking.
Yeah.
Do you guys have some type of suggestion on this is out of bound or like so simple things, right? Because my background is in cardiothoracic surgery. So if people who has gone through surgery, acute care recovery, then go to long-term care recovery, and then they still wanted to know the range of blood pressure, their daily weight,
Yep.
they're not going to heart failure.
Yeah.
So is there a platform also suggesting to say, oh, we are seeing the trend is going to this way, and this is because ABC. What's the usability besides just looking at the data itself?
So, in terms of suggesting that, hey, something is changing because of this thing, we've not added that capability yet because people in the sector are they are quite scared to even share that information. And they feel that if we were to start saying, hey, the weight is going down because, they were diagnosed with anorexia, for example, I'm just making all these things up.
Yeah.
Now we making that interpretation will be scary to the nurses. So our first step was, let's just open the access to information. And once families start understanding what those information mean, then we can add some cool stuff so that to help them be more educated. We do have sections in our platform that kind of guide them on what care plan is, for example, or what certain abbreviation mean, or what is a minimum baseline for your blood pressure, what's the threshold for the blood pressure. So those are the things that we do have, and that helps for them to understand what these information mean. And we also have ways for staff to upload education documents where families can see, okay, these are the education materials that I need to know, how to do tube feeding or how to PPE or those kind of stuff. So I feel we definitely want to do a lot of predictive analysis in our platform to the information we have. The industry is not quite there yet. Even with our patient portal, which is a patient portal, it exists everywhere. They call us, oh, wow, this is great. This is wave of the future. This is visionary. But we are not there yet. I think this is a 5 to 10 years project down the road. And I'm thinking, oh my God, this is so simple.
What do you think is the gap? Why do they think it's 5 to 10 years for them to implement this system versus for you, for, we all know, even with one of the tech advisors on our board, right? We're always talking about company, when you launch your digital platform, you should be able to launch within minimum viable product within 90 days, right? Don't make it complicated. It's a model. And you guys kind of did that, right?
Yes.
In a few months, both you and your husband are great engineers. You got to work and you put this out there. So clearly building the platform is not the issue. And then improving, we'll improve every day. How come you feel like, let's just say the people that you're talking to who are in these long-term care facility, what is the true resistance?
The true resistance is it's a very punitive industry. People historically, and also COVID did not help with the negative media press that went into the nursing home sector. Because of the punitive industry where you have inspectors every month, they come unannounced every month. There's a mindset that the staff feel that they are always punished for the work that they might have missed due to human error, instead of being commended for the care that they are providing. And because of so much inspection and fines and just this punitive culture, people are afraid to change. Someone was giving me an example where a resident was about to fall, so the nurse grabbed the resident. And because she grabbed, there was a bruise. The inspector came, said, you bruised the patient. But the inspector didn't see that the resident was about to fall, and I prevented them from falling. They would have broken their hip. They would have had to go through hip fracture. No, they were penalized for causing a bruise on the resident's arm instead of saying, great, you prevented them from falling. That's the culture we are dealing with in the long-term care sector. And that is why the industry is a little bit less susceptible to change because of fear. They are afraid that what if things go wrong? And especially for our platform where we are opening your clinical chart, you're charting all this into your EMR, EHR. We are pulling information about medication, doctor's notes, vitals, lab reports. And people are afraid that what if families don't understand it and they go and lodge a complaint? And that, so 5 to 10 years is because the nurses are not there yet. And I think a lot of things have to also come from the patient and family side, where families are going to be like, why am I calling? Do you not have a patient portal? And then they'll be like, a patient portal. If people don't even know when I say I'm a patient portal, they're like, what is that? And I'm like, we all have access to patient portals.
Right. So if you think about a bigger EHR system like Epic, you have a patient portal already. It's built in where the patient can go in. You can see all your appointments. You can see your last set of labs. Things can be just easily pulled up. Now, I believe Epic also have the ability to see clinical notes. So for us who are clinicians, we're always like, well, there are certain lines of things you wanted to add in your note because family and patient's going to read it. When they're not fully understanding what they're reading, are we overloading them with information, which there can cause a bias because when they don't know, it creates more fear. Right. And that's the principle of that. And versus, it's not that anybody want to hide, but we can have a better dialogue if they're in front of us. But the consequence is we don't have that much time to sit down and educate. So in some way, it's a movement change of how can we continuously, as you're saying, right? When you build a patient portal, it does give understanding of what that parameter of blood pressure, the vitals and the things, and then some education material to explain it. So people don't get scared of reading. I also have friends who are not medical at all, right? And then their family got sick. I think all of us are going to have, as we grow, no matter you're taking care of the younger kids who are sick or the elder parents or even your siblings. And nowadays it's not an age factor. It's simply wellness factor, right? So we're all caregivers at the end of the day. So then the challenge goes, when people don't have the information to understand it and they start Googling, right? They start doing all that. Now we have ChatGPT, then we have all the AI. But we all know AI make up stuff too. So if you don't ask the right information, you don't have the right resources. And even you gave right resources, we do a lot in AI marketing into this is the book, this is the only content you can pull, and it will do 90% of the good job, right? So I think that's the fear it comes in. It's not necessarily people don't want it to be transparent. It's going back to the point of how do we educate them with the information that they receive. So we're not creating fear, but we're actually creating ease at the same time.
Exactly. And I think what we've also learned from our experience is that there's always going to be the 10% of patients and their caregivers that are going to, for lack of a better word, be more inquisitive. They're going to ask you a lot of questions. They're going to call you every day, no matter whether you have a patient portal or not. And those 10% of very passionate caregivers, we call them very involved. They're always going to be involved. There's nothing you can do. But there are 90% of those families who just wants to know if mom is okay, who just wants to know if something is wrong, what can they do? How can they help? They're not as involved. And so, when we go live, the director of nursing and the staff are so apprehensive. They are like, oh my goodness, all this information is going to be shared. Now we can't document properly because now I'm afraid. And so before they go live, they're like, this is not going to work. But the management has said, we are going to implement this. We're going to try this. It's a top-down approach. And this was a very recent case that happened to us. So, I was talking to the director of nursing and she said, this is not going to work. Family's going to be so upset. And our families are very involved. They like calling. We like talking. And I said, great. Let's try this out. I'm going to follow up in a week and you can let me know how this is working. And if it doesn't work, we'll stop. And so, we we go live, and within a week, we had 70% of families activate and sign up. And I called the director of nursing saying, hey, you guys are at 70% in just a week. Usually it takes 6 weeks. And she's like, this has opened up my mind. Like, I am shocked the way it has been received. I'm like, are you getting questions? And she's like, I am getting questions, but those are good questions. I want them to ask me those questions. I don't want them to ask me, how's mom? It's all good questions. And they were very open and accepting. And they did realize that there are going to be 10% of people who are going to be like, you didn't chart this. What does this CPO mean? What does AR mean? Right. And they're like, they're always going to ask me questions, but there's 90% of people, the feedback we've been receiving has been great. And so we are like, okay, we are only going to focus on the 80-20 rule, where it's the 80% of people we are going to cater to, because 20% of people are going to be unhappy no matter what we do. I have family members email me and say, this is a piece of crap. And I'm like, great, thanks for the feedback. Let's move on.
Yeah, exactly. You can't make everyone happy.
No, cannot. And
it's not realistic.
And I think that's what we also have to educate to the staff, saying you cannot make everybody happy. You cannot, like, there are going to be questions, there are going to be concerns, but 80% of them, 90% of them, they're going to be so grateful, and they are, and we see that. And so all these stories just reinforces that we just need to persevere and wait for people to open their mind. And you are a cardiac surgeon, you know how 95% of the heart cells needs to be in rhythm to like operate properly, the critical mass. And we strongly believe that we need to achieve a critical mass of people using this platform, being transparent in care, and then the industry is just going to change.
Awesome. So where is this company going? What's the goal right now? It's a more connecting with more facilities, or is it expanding with other EHR integration? Where are we going with it?
Right. So right now our goal is to stay tunnel focused in the long-term care market, and point-click care is the ruler in this space. So the integration for now is going to be point-click care. We have other integrations that will come up because we want to be a one-stop platform for all family communication. And so our mission right now is to really do everything that entails family communication, from, sharing clinical information, sharing financial information. You cannot believe the amount of printouts and paperwork that goes into getting payments from families saying, hey, your loved one, this is their bed charge, or they had a hair appointment and this is a charge, and trying to get that money and trying to send those invoices is so costly. For an average home, they spend $5,000 just on printing invoices and material and printing costs. And so we're trying to digitize that, because that also falls under family communication. Another family communication is admissions, right? Like, there's just so much paperwork that goes into putting your loved one in a long-term care home. Day one, you take them to a long-term care home, you're feeling guilty that you've done this to your parents, and now you are slammed with hundreds of pages of paperwork. Yeah. So there's so much that needs to be done in terms of streamlining and digitizing family communication, and that's going to be our goal. I also have this big vision of interoperability. I feel the siloness of EMR, EHRs is just breaking the backbone of where technology can take digital health to. And so we will be in future, as we get more facilities, as we learn more, we will be expanding into making things interoperable, or that's the goal.
Yeah, right. Like once you establish a point-click care, use this as a model, then you can start expanding with other bigger systems that are more hospital-based. So you can carry on the transition of the entire cycle of the patient journey with their families.
Exactly. And our goal is to have data flow with the patient.
Yeah.
Which is, blockchain. I don't know how we're going to do it, but the data, I want to see the data move along as, the patients navigate to different continuum of care, because data is power.
Right. And then at this point, how many facilities are you guys already working with?
So we are in 80 facilities. We have 25,000 families and staff using our platform.
Amazing. Across the country?
Yes. In North America, US and Canada.
Yeah. Awesome. And what's the this next year, 2025 growth projection?
2025, we want to be at least up to 250 facilities. And this year is a product year for us because we have so many amazing feedback from our clients saying we have this pain point, we have that pain point. And they know that we are engineers, so they feel we can do things very quickly, which we have. And so 2025 is a year that we want to grow, but at the same time, make sure our product really serves and answers all the questions and hesitations and just is makes sense and people are not hesitant to use it.
Right. It's the nice balance of we needed to get more people know about us serving the community as well as spending set of time and money to continue to improve the platform to already fill the gaps that other people are asking, right? And they see the benefit. Then how do we make it even better? So it's always, I think as a founder, you're always going to be in that, right? The revenue driven, the expansion driven path, as well as the improving path. And we're at first, and as you expand the team, I'm sure you can properly diversify those. So then I also love to end with a fun question. So we give you a magic wand, and the magic wand will grant you 3 wishes.
Oh dear, okay.
All right. And then, so what would you use the 3 wishes for your company right now?
Oh, any 3 wishes for the company?
Yeah.
So right now we are so product driven. We have so many cool ideas that we could do. So my first magic wand would be have all these ideas into an actual viable product, into the product where it just works and it makes sense, because we are trying to add stuff that will make staff life even more efficient, but also families also it's helpful for them. So the number one grand wishes is for them to read my mind and to put all that into a product. My CTO is working on that, but a magic wand will really help. Second one would be to really change the culture of long-term care. I want the culture of long-term care to shift from a punitive culture with a lot of inspection and surveys to a more collaborative environment where the state, the government, the administration, the organization, the families, the patients are all working towards a goal of improving quality of people who are living in this long-term care home. And for that, we need a huge mindset change in people. So my second magic wand would be, let's change the mindset and culture of the long-term care industry and make it a positive thing. Like nobody should have guilt to put their loved one in a long-term care home. Let's make it that exciting. It's not going to be exciting, but not make it as an apprehensive, guilt-ridden thing. Third would be a lot of customers. I mean, that is given. Growing our team is going to come with more customers, more revenue. So that would be third for a very selfish reason.
Yeah, you have to expand, right? If you don't have the right people on your team that can represent the brand and they can't get out there to really help a lot of families. So it's all integrated, right?
Yes, exactly.
Your 3 things is like make product better,
people,
get all the, and then get the people and mindset, right? And it's that multidimensional view of that's how when it's all connected, that's how we create change. And sometimes as entrepreneurs, we always want things happen yesterday, right?
That's true.
And then give ourselves the grace and compassion to say, I have this big mission and then I will get there. We have great support already that helps with that lightness and space that we can create as we drive this.
One thing I've learned in healthcare, generally, it's not the fastest. It's the one who can really persevere.
Yeah.
It is a game of perseverance. I don't know how fintech or ag tech, ed tech or other industries are, but in healthcare, it's a game of perseverance because people are going to look at your idea, think about it for years, and then they're going to finally sign the contract.
Right. Yeah. Because we switch different hats for us as well, right? Do we wear the investor hat when we're looking at the companies, or do we wear the organizational hat to say like which of our network of organization would really care about these things, right? And then we have to wear our own consultant hat. It's like, do I even believe in these companies enough for us to support them in this journey? Or they're just yet another big goal, passionate person, but don't really have the dots in a row to even do things, right? So I think it's challenging for all those departments. And at the end of the day, it's about collaboration with the right intention and not the blaming, as you mentioned. So lots of fun things in healthcare, a lot of things we just have to keep going, right? Have the grit behind it, the passion, the drive, the belief system in ourselves, in the people that we take care, and then in the team that we create. So how can people find more about you? What would you love for all the support for your company for?
Just come check us out, Evoke Health, or just Google Family Portal in long-term care home. We are going to be the first source, hopefully, that comes up.
Right.
SEO. And I think people should also know that, there is a technology burden. There are so many tools. There's so many different things. The nurses, the staff, the administrators have to navigate so many tools. And what we've done is we've used common sense to build our portal. It is truly just common sense. There's no rocket science. If you're looking for something that is really easy to onboard, it takes 2 hours to get us up and running. And you want to streamline family communication and also make things easier for your staff and get more people choose your organization over an organization who down the road, you need to implement a family communication portal.
Awesome.
Thank you, Sabrina, for this time.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.